Have you experienced any changes in your stomach since receiving a thyroid condition diagnosis? If so, you are not alone in dealing with issues including weight gain, sadness, and hair loss. Thyroid belly is a troubling ailment that can potentially be caused by your thyroid. Thyroid belly, what is it? Thyroid patients appear to be the only ones with this distinctive abdominal distension, which can vary in severity from mild to severe. In mild cases, it may simply give the appearance that you've eaten a large meal, but in severe cases, it may make you appear pregnant. Some thyroid patients even think that the only cause of their thyroid belly is fat. Some people, however, think it has nothing to do with the stomach. Actually, the truth is that all of these factors can be linked to your thyroid. Although having to deal with this frustrating condition is unpleasant, the good news is that you can treat and get rid of it. However, to do so, you need to know what causes it, and visceral fat is the first and most dangerous type of fat we will talk about. Visceral fat is the worst kind of fat you can gain on your body because it surrounds your organs. Visceral fat is the first type of fat that you should address because, believe it or not, research has shown that some people are more likely to develop visceral fat over subcutaneous fat. And at least part of this tendency has to do with genetics. The other part, the part that actually matters for this discussion, is related to your lifestyle and to your thyroid. Although both types of fat can cause problems and both can contribute to the thyroid belly shape, visceral fat is proven to be much more dangerous than its cousin subcutaneous fat. It is well known that visceral fat is frequently linked to the metabolic syndrome, a group of issues that includes insulin resistance, high blood pressure, high cholesterol, and obesity. Individuals who exhibit all four of these symptoms are considered to have metabolic syndrome. Regretfully, thyroid failure directly affects weight, blood pressure, cholesterol, and metabolic syndrome, which is likely why approximately 1 in 4 individuals with thyroid issues also have metabolic syndrome. While having a thyroid issue increases your risk of developing metabolic syndrome, it does not ensure it. As a result, many thyroid patients end up with metabolic syndrome and a significant amount of visceral fat to accompany it. Number 2 on the list is gas and bloating. Even though visceral fat is found deep within your body where it surrounds your organs, as it enlarges and gets bigger and bigger, it pushes outward on your abdomen, causing a distension of the abdomen that contributes to the thyroid belly appearance. Even if visceral fat isn't the cause of your thyroid belly, your stomach is most likely malfunctioning in this case. Because of the way thyroid hormone affects the gut, in a healthy state, thyroid patients are more likely to develop a variety of gut issues, such as infections like H. pylori, and even overgrowth syndromes like small intestinal bacterial overgrowth. Thyroid hormone facilitates the regular, rhythmic motion of your intestines known as peristalsis. However, when your thyroid is either too high or too low, it will cause your intestines to move more quickly or more slowly, respectively. For this reason, constipation is frequently caused by hypothyroidism and diarrhea by hyperthyroidism. Constipation and gas are the two main causes of abdominal distension that thyroid patients with hypothyroidism or Hashimoto thyroiditis must contend with. Both of these factors contribute to the thyroid belly appearance. Understanding constipation is rather simple. Food will remain in your intestines for longer than it should if your digestive system is operating more slowly than it should. The more constipated you are, the more stool you will have inside your abdomen and the more it will push outward. The second is due to increased gas production. Instead of having a bowel movement every 24 hours as you should, you may have one every 2, 3, or even 4 days. Small intestinal bacterial overgrowth is a condition that hypothyroid patients are more likely to develop because thyroid dysfunction affects gut motility, which in turn affects the concentration of bacteria found inside the small intestines. Gas is typically caused by swallowing too much air, but it can also be produced by the composition of bacteria inside your gut. So what does this really for thyroid belly fat? Let's find out, but first, if you made it this far into the video, thank you. These videos take a lot of effort and time to make, so If you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. Research studies have indicated that almost 50% of thyroid patients, or 1 in 2, have this illness. It is therefore quite frequent among thyroid patients. Constipation and gas can both contribute to the form of your thyroid. So if you want to get rid of it, you need to optimize your gut. Subcutaneous fat comes in at number 3 on the list. Compared to the other topics we've covered so far, it may be simple to dismiss subcutaneous fat as something you shouldn't worry about. But that would be incorrect because, as I've already explained, subcutaneous fat is the kind of fat that is directly beneath your skin. You can think of it as the kind of fat that jiggles and wiggles. Since subcutaneous fat is the kind of fat that is felt with the fingertips, most individuals refer to it when they say they'd wish to reduce belly fat. Sadly, thyroid patients are more likely to grow visceral and subcutaneous fat. But which one they acquire more of depends on their circumstances. You can think of it this way. The effects of a hypothyroid or low thyroid state on metabolism might lead to weight gain. It's rather simple. The slower your metabolism, the higher your risk of gaining weight. However, lifestyle factors like the type of food you eat and your level of activity affect where your body stores fat. For example, your body will be more likely to store excess fat in the subcutaneous area if you overeat relatively healthy foods. This is because, in addition to being metabolically healthy, excess fat on your body can still produce hormones like leptin, which can communicate with your brain. On the other hand, if you consume relatively unhealthy foods, such as processed foods, fast food, industrial seed oils, etc., your body will be more likely to store any additional fat you gain in your viscera. This is due to the fact that these unhealthy, processed foods not only consume too many calories, however, they also cause inflammation, which damages your fat cells and results in adiposopathy. The majority of thyroid patients will eventually develop a combination of visceral and subcutaneous fat, but the precise ratio will differ based on the factors we just covered, such as your lifestyle. Subcutaneous fat still adds to the thyroid belly form and is not very aesthetically pleasant. So even while it won't likely raise your risk of heart disease as much as visceral fat does, you should still probably get rid of it if you want a flat abdomen. The fourth is fluid retention. The hypothyroid state can cause fluid accumulation in many tissues because of its effects on a substance called hyaluronic acid. If this occurs in your wrist, it may lead to carpal tunnel syndrome. If it occurs in your legs, it may result in peripheral edema. It's not as frequent as the other 3 disorders, but if it occurs in your face, you'll end up with puffy eyes or a hypothyroid-looking face. If it occurs in your belly or abdomen, you'll end up with a thyroid-shaped belly. I just brought it up, but it does occasionally come up, so it's still crucial for you to know that the good news is that this issue usually resolves itself. Can you get rid of a thyroid belly form as you treat the other diseases I just mentioned? Eliminating the thyroid belly shape is all about addressing your treatment at the right problem, which is exactly why I spent so much time explaining each of these 4 causes. Once you have determined which of these problems is more important to your particular situation, it's just a matter of addressing that problem. And even if you are someone who can't get a completely flat stomach, you can very often get very close. Since you are unsure of the root cause of your issue, I would advise beginning with optimizing thyroid function. You can achieve this naturally by following a diet, leading a healthy lifestyle, and taking supplements, or you can choose to use prescription thyroid medications, which is a more prescribed approach. Either way, I have a ton of resources available to assist you in achieving this goal. If you're interested in learning more about optimizing your thyroid, I suggest watching the video that follows. Understanding the thyroid belly shape is just one step towards taking control of your health. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe to Health Angel Solutions for more insights into your well-being. Together, we can make healthier choices every day. Thanks for watching.